Is the HPV test part of cervical cancer screening? Absolutely. The human papillomavirus test is a vital component of cervical cancer screening. It plays a key role in identifying the risk of developing cervical cancer. Cervical cancer screening is designed to find precancerous changes or infections that could lead to cancer if not treated. The HPV test specifically detects high-risk types of human papillomavirus, which are the primary cause of cervical cancer. When it comes to screening guidelines, they vary based on age. For individuals aged 21 to 29 years, the primary method is the Pap test, also known as cervical cytology, which is recommended every 3 years. In this age group, HPV testing alone is generally not the first choice, although it may be considered starting at age 25. For those aged 30 to 65 years, there are 3 recommended screening options. The first option is primary high-risk HPV testing every 5 years. The second option is coat testing, which involves both the HPV test and the Pap test every 5 years. The third option is the Pap test alone every 3 years. These options are effective in detecting cervical cancer early while minimizing unnecessary follow-ups. The HPV test works by identifying the DNA or RNA of high-risk HPV types in cervical cells collected during a pelvic exam. Since persistent infection with these high-risk HPV types is the leading cause of cervical cancer, detecting these infections is crucial. It helps identify individuals who may need closer monitoring or treatment before cancer develops. During cervical cancer screening, a healthcare provider collects cells from the cervix using a brush or similar tool. Often, the same sample can be used for both the Pap and HPV tests, making the process more efficient. It is important to remember that a positive HPV test does not mean a person has cervical cancer. Many HPV infections clear up on their own without causing any disease. However, if a high-risk HPV type persists, follow-up is necessary to prevent the potential progression to cancer. From the perspective of reproductive cancers, including cervical cancer, the HPV test is an essential tool in early detection and prevention. Regular screening using HPV testing, whether alone or in combination with cytology, has significantly reduced the incidence and mortality rates of cervical cancer. In summary, the HPV test is a recommended and crucial part of cervical cancer screening for individuals aged 30 to 65 years and may be selectively used for younger individuals. It complements or sometimes replaces the Pap test to enhance early detection of cervical cancer precursors. Always consult a healthcare professional for personalized advice and screening recommendations.